The relationship between vestibular, sensory processing, anxiety, and ADHD. In the traditional medical model, we are trained to view things like anxiety and ADHD as conditions separate from our ability to process the world around us. As a young pediatric therapist, I noticed many of my patients that I saw for sensory sensitivities also had symptoms of anxiety and ADHD. Then, as a traveling OT and SNFs, so many of my patients with balance disorders also had anxiety, such as fear of falling. When I started training in neurology, I learned there is a direct correlation. The nervous system needs to first feel safe and secure before it can do other things. If the brain feels insecure or off balance, it is not confident in where we are in space or where we are moving, then it sends out an alert to notify us that something might be wrong. That alert is connected to the autonomic nervous system, which activates fight, flight, freeze. When in fight, flight, which is the sympathetic nervous system, many physiological things change, such as increased heart rate, air hunger, and stress chemicals are released, such as adrenaline and cortisol. All of this disrupts many functions of the body and brain. Vestibular dysfunction can lead to anxiety. Research shows that vestibular issues in kids increases anxiety by 500%. Then when we are in fight or flight, our system is on edge and processing everything around us to determine if it's a threat to our survival. The classic example of fight or flight is going for a hike in the woods. If we're going for a hike in the woods and we hear a loud noise in a bush up in the trail ahead of us, in that moment we go into fight, flight, and perk up to pay attention with all of our senses. This is vital if we are in the woods and there is potentially a bear. This is a deficit if we are at home, at work, or at school attempting to focus on only the important information and tune out the irrelevant information. This is one of the ways vestibular dysfunctions play a role in sensory processing as well as ADHD. If the brain is in fight or flight, it has a lot of information to process. It can become overwhelming and lead to irritability, fatigue, meltdowns, and even migraines. By effectively treating the vestibular dysfunction, we can improve so many conditions. Thanks for listening, and check out more of our videos about how we can exercise the brain to get improved patient outcomes. cnsitherapies.com. You can find over 200 research articles and recommended books that could also be helpful.